So this is just a short video on how to do eyelid care. Dr. Vale has probably instructed you to do it, or it's been in your pre-op instructions, or you just came in for a regular exam and you need to know how to do lid care. So the first step is cleansing the eyelids. There's a few cleansers on the market. There's OcuSoft, Sustain, Sterilid. You could get these towelettes in the drugstore and they're convenient, but they're a little bit pricey. So it's always going to be a little bit cheaper to use it in the foam form. These will be self-explanatory after I explain to you how to use the foam. So if you're using the foam, you want to take a washcloth, put it in hot water, wring it out, spray the foam on, and clean your eyelids. Just go in a gentle back and forth motion on the upper lid and the lower lid, paying very close attention to the lash line. Go very, very close. And you want to do each lid separately, because if you're just closing your eyes and doing it, you're really not properly getting that lower lid. You're not going to go inside the eye, but very, very close to the lash line. Do the whole eyelid. You want to do that for about a minute on each eye 2 times a day. After that, we're going to do warm compress therapy. This is easiest, okay? This is a moist heat mask. When we're doing this part, it has to be a moist heat. It cannot be a dry heat. It's the only way it's going to work. So I'll back up to the free method would be the washcloth method. So if you want to go that route, what you're going to do is take that washcloth that you used earlier to cleanse, put it in really hot water. You want it very hot, but don't burn yourself. Wring it out and place it over your eyes for at least 5 minutes. Now it's going to get cold, so you do have to keep heating it up. You want it as hot as you could tolerate it without burning your eyelids. After that amount of time, what you've done is loosen the oils that are in the oil glands of your lid margins, your meibomian glands. So we want to express that oil out afterwards. So you're going to take the pad of your finger. Okay, now I have long fingernails, so it's a little different for me. I have to use the side of my finger, but you're going to get more pressure, and it's going to be better if you could use the pad of your finger. So to express that oil out for the bottom lid, you would look up, get very close to that lash line again, go against the white of the eye and push very hard. Put a lot of pressure. Don't be light about it. We need a lot of pressure. Push that out, okay? That is going to push those oils out of the meibomian glands. Now, for the top lid, it's a little more difficult, so sometimes it's easier if you kind of swing your arm around, opposite arm for opposite eye, and you're going to, again, do the same thing, but you're going to push in against the eye with the top lid, very close to that lid margin. Push, 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 very hard, okay? Now you'll know you're doing it right. It's going to get cloudy, and that's the oils. By putting that layer of oil over your eyes, you're preventing your tears from evaporating as quickly, and you're opening up any of those meibomian glands. Now, people with severe dry eye, Dr. Vale would recommend using the washcloth with a silica mask underneath it. You've probably seen them in the stores. They're very common. A lot of them look like they're filled with beads. This is going to be a gel that's a solid. You're going to heat that up to 180 degrees, and you're going to wrap it in that wet washcloth. Then you're going to place it over your eyes. Then we know it's hot enough, okay? Sometimes with the water you can't get it hot enough, and it will stay warmer longer. So that's very important to follow that if he's telling you to do that. Now back to what I think is the easiest, but you know, whatever Dr. Vale recommends. This has silica beads in it. So you put it in the microwave. 30 seconds seems to be the magic number, but everybody's microwave is different, so be careful. You're going to take it out, make sure it's not too hot, place it over your eyes, Velcro it in the back, and you could just lay down. It's actually very relaxing, very comforting. It's going to stay hot and it's going to stay moist, so you don't have to keep heating up the washcloth. Again, we have all of this stuff here. We have the OcuSoft cleanser, but not in the pads. We only have the foam. We have these masks. We're only doing it for convenience for the patient, so if you see them somewhere else, you want to get them on Amazon, Walmart, CVS, wherever you want to get this stuff, but just get it, okay? Also, if you're having surgery starting the day after surgery, you need to use preservative-free artificial tears for a while on a regimen. This is the brand we recommend, Refresh Optive. Now, they make a regular one without the omega-3 in it, but this has flaxseed oil in it, so it's a little more moisturizing. He may recommend you use these anyway, even if you're not having surgery. So these will start the day after surgery. And although they say single use, you could actually get a few uses out of these. They twist off and they recap. Just keep it sterile, don't let it touch your eye, don't let it touch anything else. Recap it right away. If it does touch something, throw it away and get a new one, okay? So that basically sums it up. If there's any other questions, you can call the office and we can help you with any questions you might have. Thank you.